This video compares and contrasts obstructive versus restrictive lung diseases.
Obstructive and restrictive lung diseases are disorders that make breathing difficult for people but present in different ways. The first type of lung disease we will talk about is obstructive. Examples of obstructive diseases are emphysema, asthma, and chronic bronchitis. Features of obstructive lung diseases are lung hyperinflation, elevation of the shoulder girdle, barrel-shaped thorax, flattened diaphragm, and increased use of accessory muscles, which may be noted with observable hypertrophy of the patient's upper chest musculature. Here we have an obstructed lung versus a normal lung. With the obstructed lung, we see the normal lung volumes will change quite a bit. The biggest change that happens with obstructive lung disease is the large residual volume. This is due to the lack of ability to expire the air out of the overinflated lung. Tidal volume also increases due to the increase of total lung capacity. Keep in mind, with obstructive disease, it is a flow problem, not a volume problem. Here we have an example of what ventilation of a normal lung looks like. As we can see, the lung, or balloon in this case, can inflate and deflate with inspiration and expiration with no difficulty. Now we have an example of an obstructed lung during ventilation. As we can see, the lung is hyperinflated and it is very difficult to get air out of the lung. This can be caused by retained secretions, inflammation of the mucosal lining of the airway, bronchial constriction, and weakened support structure of the lung tissue and chest wall. Now let's take a look at a restricted lung versus a normal lung. With restrictive lung disease, the total lung capacity is much smaller than the normal lung. Consequently, all of the other lung volumes will be decreased as well. Remember, restrictive lung disease is a volume problem, not a flow problem. Now we have an example of a restricted lung during ventilation. We have applied an external restriction to the lung to represent the physiologic causes that may contribute to these diseases. Some examples of these physiologic conditions include scoliosis, coal worker's lung, pulmonary edema, atelectasis, obesity, and pregnancy. While the flow of inspiration and expiration is not affected, the overall lung volume is decreased.